was revealed during a stakeholders forum that IMCC organized. Save Ghana, with a research background, was interested in conducting the study. Of course, IMCC, International Medical Cooperation Committee, was also interested and committed to make sure that this come to pass.
We held a stakeholders meeting, and it came out as a concern that men's participation in CT services is low in the district. The number of people who will want to be tested to know their HIV status could increase in the district. By so doing, we will know all the people that might be victims of the circumstance. In other words, those who might test positive, and therefore we will give them the opportunity to start treatment to prolong their lives.
I think that our focus is on men. Men, because of the fact that the patronage for men is very low. And I think that it is men who know what their perceptions, or who can tell better why they don't want to come for CT services. If you take if me, for example, goes to Nobilo to do something, they won't understand anything. No. You see, because of the language barrier. So what I think is that if it is appropriate that somebody like Samar, who knows a lot about drama, if he does the right up, then go get people who will, who, for instance, understand English, who can do the drama in the language that the people understand.
After you have spoken to them, then the play comes in. What do they think? Does it change their perception?
What do we learn from it, or what is it that you saw in the play?
The method that we use in conducting this study was PRA, Participating Rural Approach, and that is a model that you can use to pick data very fast, and it with less time and less resources. As part of the model, we use information pyramid. That is to help us to be able to capture all the segments of the aspect that we want to cover.
We will have this thing, the information pyramid in the form of a triangle. Okay. So that starting from the national level, what policy is there that affects men's perception of the city, to the regional level, and to the final to the community level. The top one is not necessarily the least important one. It means that what is happening at the national level, but the one at the bottom, that the community level, is where our concern is, and that is the most important one.
So that the point I'm making is that this is something that should guide us, either what we should know and what we should ask.
Yes, I think the first reason is that to guide us in our data collection, so that we don't go to the field to collect the data and only come to realize that we have left a segment or an aspect of the community that could affect their perception. You know, women have a lot of these groups. Yes. That they don't call them Zusu associations and all that. So they are able to discuss these things. Yes. We also find out whether men also have these groups. You see? Yeah. Now, our men, do they have these groups? They will prefer to go when we go, you will find out. Prefer to go to drinking. But now that we have finished with the information pyramid, I think let's start looking at how we will develop our personnel. What I'm trying to say is that once we can have 3 or 4 broad categories, or headings or subheadings, where we know we'll be asking questions under.
Whether the city centers are accessible to the people. We will also look at if it is accessible. Are the people, why are they not going for it?
One of the most important aspect of this study is the training. The training of those going to do the questioning, where we train them on how to observe, how to ask questions, how to interact with people at the field. These are things that will help in coming out with the right information.
This morning we are here at this facility to
with our volunteers that will be conducting a research on the perception of men on CT in the Sissala East district, and we have picked those volunteers from 3 sub-districts. They are health workers in those communities. We visited 6 communities in all. Today we'll be learning the method that we'll be using, which is the rapid participatory approach, to be able to gather our data quickly and not wasting much time and resources.
What will you do if you are afraid to have HIV/AIDS?
What will I do?
Yes.
If
you are afraid you have HIV/AIDS,
I'll go for counseling and testing.
Did you say counseling and testing?
Yes.
Where did you hear about it? Where?
Where?
Yes.
I heard it on air.
When you ask a question and everybody's keeping quiet, nobody's answering, it means they may not understand the question. Reframe it in a different way. When you ask the question like you were saying, then look at her. She will know that you are looking at her. You are interested in what she will say. We chose to work with Ghana Health Service personnel on certain reasons, and that is to improve their capacity to be able to do such interviews themselves, and also because they will also be part of the implementation process when we are through with the finders. So it will be good to get them involved so that they will know the first-hand information on what is coming from the field.
Piloting questionnaire in a study is very important because it will help you to know whether that is even the right questions that you have set. Whether at the field, some of the challenges that you will face, you will discover them during the pilot, so that you go back and reorganize yourself before starting the real study.
Fully harable testing and counseling. Go to counseling and testing. Very watching, I'm what very watching, I'm what testing and la be a la honorable. Very watching.
I've been in a can't pull you and yell and go.
From the pilot test that we did of our questionnaires, we discovered that some of the questions that we framed, the people will not understand them. So we came back and reframed them in a better way. And when we went to the real study, it was okay for us. We also didn't anticipate children coming around. So in the real study, we took that as a lesson. In the design of the study, we took into consideration certain aspects. That is the religious aspect and how it influenced people's perception with regards to CT or general HIV/AIDS issue.
Where can we end up with my Malan de Wobble? I'm out here for you in Galila.
Wabble not say Abu Jomisian Hirina. How will get Winchana Palabu? They hallowed. How will get Winchana Mugan? Say, Magarena no Halle with Juntina Hanaka. They are a Polita Cantina, the very Ohalo, Jimmy Mocha, okay, you know how can Obalang, Pohalo, Makavino, the Otto Malang Ablock, but not Ohalo Janampana, Aramuri.
Yeah, so today we have been in Kobe to find out, to talk to the men groups as well as women groups to see how it will go. Yeah, it's amazing. Some very interesting things are coming up. One of the things is that somebody suggested that as a way of improving as a way of controlling the spread of HIV is if we could quarantine anybody who happened to be tested, who test positive. If such people could be quarantined, if we could build a place where these people could be put together to live together, he thought that could be a way of preventing further spread of the disease. Then I said that, oh, there's a place somewhere in the northern region called Gambaga, which is camp. And I wonder how many people go there. So, and from there, another person said that getting to know about your status is just like finding out about your own death, as such that they don't have the heart, they don't have the confidence, I don't know how to describe it, they don't have the heart to be able to find out about their status. Yeah, so, and after the interview, I took the opportunity to educate them about the way, the symptoms, the signs, how the disease could be spread, and as how they could also prevent it. And one person said that one of his friends said, oh, he has been hearing about condom, but he hasn't used it before. Then one time he decided to try to see how it will go. Then when he tried it and he was on his wife and it was getting on, he said, oh, when the thing was getting interesting, then the thing just burst, pow. And then I also took that as an opportunity to educate him on how properly to use the condom. Then I think that more education could be something that is necessary in the future.
Mahanya menaho ama nara donga dakar weru ko jang kulli mi ya la ya yu kware apali weri ko no makan tan ko la tanari alha ma purmi suwe akiam ai kiam ni ko mun na hangwa kere ko mutu ko lele sinare de mi da ka hela amma ni ba buriya ba.
A lot of very interesting issues are coming up, like the mode of transmission. People think that you can get HIV/AIDS through a mere sharing of drinking cup with others. Others also think that when you urinate, another person goes to urinate there, you get HIV/AIDS. They think that HIV/AIDS is now abundant, it's everywhere. So if you are walking and you are not careful, you get HIV/AIDS. These are some interesting things that people have mentioned. With regards to CT, people don't even know that CT services are just closer to them in their community. For instance, in Klufo, people don't even know that Klufo Health Center do CT services. In Nablo, that we have just finished, they don't even know that there is CT services in Nablo Health Center. So these are all things that are causing the low patronage of CT in our sub-district. We also know that people are also saying that because women have access to ANC and postnatal care, when they go to these services, they use the opportunity to test them for HIV/AIDS, which the men do not get this opportunity. So this is one of the reasons why women attend more than men. I think that in the first interview with old men above 30 years, we realized that the major place that HIV/AIDS is transmitted is through funeral grounds. So realizing this, we decided to frame it in a drama to see what the people even think and whether that thing that was raised in the first interview was even true.
I was actually called to dramatize on why many people don't go for CT services, especially the men. in this part of our country, at the Sissala district per se. The just ended drama is showcasing the behavior of the people over here. You could see that in the drama, not different people were brought to act, but the community members themselves were selected at random to actually partake in the drama. So the drama actually has been showcased, trying to portray the life and how HIV/AIDS is most spread in this part of our country. So in the drama, I acted as the chief dramatist, and I have a friend who actually visits me. The other one also played the role as awareness creator. He came and actually informed whether we have heard about HIV/AIDS and CT services. I said I have heard, but I would not like to go in for CT services due to my own reasons. Because number one, I am a chaser, and I wouldn't like to go in for CT services so that I will know that my life is at risk. So I wouldn't like to know that I have HIV/AIDS. And because I also want to continue in my immoral acts. So that later in the story, in the drama, I was suffering and I could see the symptoms showing on my body as an HIV/AIDS patient. I was vomiting, and I could not also eat, and a lot of things that came as a result of my negligence. So I think the drama actually has come as a timely reminder to remind our community members and everybody who actually is having the opportunity to look at it, to watch this drama, to please look at the way we behave sexually and also behaving generally. Ay, mo boy ay. Mulur. Nale. Oh. Ah. Eka dia tamu yo, imuti kia dosi yo hotu waro. Mo bagage mudido. Ma pala bro kya wodi. Iya bro mo denga gudile mo pala wodi. Kamane pala mo dole. Mre pala nya bananda. Anan do de rembu ko da ko bro wa ko bro we. Oh. E sikin na se we amburan ka se mo ya. Ibna we ya ko. Ne na we la ya we. Ni bu ke gida ka tuwase. Musafa jima mo ko jegle ne. Na mure pala nya banana la. Lele ya nya. Kenye gwere nkamori ankabe mbali akamora. Mamora. Akamora. Mona sabo mo. Aka mu don free be benni. Assalamu alaikum. Bere ki bola. Maaleykum salam. I feel good. For me, I feel good when I see that my other colleague or my brother or my sister coming from the same community, the same family, is acting, telling me something that I need to take home. Then I feel very important. I feel very proud. And the information gets down well than somebody coming from somewhere to tell me. So that was why we used the community members themselves to actually showcase the drama.
Wawok mu yosi don tamburo wa wo gon wa jimiri la hanjosi to wila don awo kano wa wo jimiro gon la ma porna na ko
They were all involved. Everybody wanted to be part of the drama. That shows how effective drama can be used in collecting data.
Kon la nyaraha wala nya tanga hilata abina na kan ba mo filinya onya wosaya ni hilata rala ilin lanai
wori sambala ni babure nya amali kam mo asasalu to wori nerte we atim bro wori nya wele aya wele fali to balare asasala ka kullu de akoro situa abu mono aka kwani de kan hanwele yana kwatinare ko poi haro to triya kana koni da hanwele kana wala hafa mu ana zo sa ko pe lo pe don ka don engano ibro fa pe bun akitikia police el hadone to fire sa kuri pero kiti o sa kore walo godira no obro kompe so o excellent de episode ni and this one.
Antenatal care and postnatal care accounts for why majority of the women have CT as compared to men. Also, stigma is contributing to why low patronage of CT in our district.
It is a social problem. It's not only a health issue. Therefore, all stakeholders, all NGOs in the Sissala East, I urge you all to come together and let's fight against the stigma.
People are not aware that there are CT services closer to their doorsteps.
CT, PMCT services are available. Some don't know. All of us cannot read and write. It's a disadvantage to our illiterate brothers and sisters. For those of us who know, who can read and write, to get them on board by educating them, by referring them, directing them to the facilities where these services are available.
The cost associated to CT is carrying away a lot of people.
Kela ba hajan ka test nangi ka ko billah Allah abro free ne pen ya ngwan kwen jango blo mana janga
We think that awareness should be created about HIV/AIDS counseling and testing centers. Stigma reduction should be the focus of all stakeholders in HIV/AIDS.
The person with HIV is still your relative. A friend with HIV is still your friend.
Men should be involved in antenatal care and postnatal care. Through that, they can be educated, counseled, and tested.
Sissala Drums Entertainment presents the HIV/AIDS campaign, Chapter 1. AIDS is real. We are all at risk. Let's go. HIV/AIDS make a brother feel sad. HIV/AIDS make a sister feel apart. HIV/AIDS make a brother feel sad. HIV/AIDS make a sister feel apart. Make a brother feel, make a sister feel, make a brother feel, make a sister feel. HIV/AIDS make a brother feel sad. HIV/AIDS make a sister feel apart. HIV/AIDS make a brother feel sad. HIV/AIDS make a sister feel apart. Make a brother feel, make a sister feel, make a brother feel, make a sister feel.